So today we are going to look at the clinical management functionalities. But before we do that, there is a functionality that the clinical management depends on. For every member of the clinical care team, somebody, maybe the clinical care nurse, will have the routine permission. Once you are assigned the routine permission, you will see appointments / patient monitoring sub-menu on the list of your pages menu. If you expand the appointments / patient monitoring menu, you will find a link to view pending appointments, a link to schedule new clinical management or CD4s or viral load appointments, a link to schedule the counseling appointments, to change appointment dates, to create a visit, to get adherence readiness information, to monitor clients, and to look at the routine tests. When you click on pending appointments, this gives you the list of everyone who has an appointment and the purpose of the appointment and the date of the appointment. So once we start creating appointments, we should see this page populated. To schedule new clinical management CD4 or viral load appointments, you will enter the unique ID of the client who you want to schedule this appointment for. And if the client is already registered into care, this should go through. There are 5 reasons for appointments. Either you are given an appointment for them to come in to get a request for CD4 test or viral load test, or for HIV clinical management, or for TB clinical management for those with TB, and other clinical management for clients who are not HIV positive or who do not have TB, but are referred for other STIs or for prevention. So if I want to schedule this for HIV clinical management, and I'll put the date of appointment as today. Now, regardless of the dates, the system allows you access to this client's file, even if they come a day before, a day after. The reason why you want to use appointments is to, 1, get things organized, and number 2, for the system to be able to track when people do not show up for appointments. So I'm going to, for demonstration purpose, put this appointment to be 10th of February. And I'll schedule the appointment. Now the appointment has been created. Now I made this appointment on the 10th of February. And what the system does on every new day is to look at the list of those who have an appointment that is expired and did not show up for the appointments. And if you go to monitor clients, you will go under missed appointments and you'll find that unique ID listed as a client who missed an appointment and the date of the supposed appointment. So the reason I made the appointment 10th of February is because I want to show you how the system flags missed appointments. So whenever this client comes back into care or comes back for a visit, this is going to change from missed appointments. In the events where this client had called and cannot make the appointment, you can come here to change appointment date so that the system does not flag this person as a missed appointment for no reason. So now I want to change the appointment date to today. And when I go back to patient monitoring, the client is no longer on the missed appointment list because we now know the reason why the person missed an appointment. The person would have called to reschedule the appointment. Under the monitor clients, we have CD4 and viral load monitoring. And what this does is to give you the unique IDs of the clients with the date of their last CD4 and the proposed date of the next CD4. the date of the last viral load test, and the proposed date of the next viral load test. The system automatically sets next dates for CD4s to be 3 months after the last date, and next date for viral loads to be 6 months after the last date. So you don't necessarily need to do the test on the next date. You just follow the regulations in your country on the timings between tests. But this is just there to guide so that if there is a need for CD4, you would have seen that the last one was done maybe over 6 months ago, and the next one was supposed to be done 3 months ago, but you did not do it. And if you feel there's a need, you can go ahead to do it. But in the events where you do every 3 months testing, then the system gives you the dates where you should do the next test.
Hi, Mildred. We in St. Vincent here normally do it every 4 months. Is that a problem, seeing where that the system will be flagging every 3 months?
No, it's not a problem. The system just flags you to keep you on your toes, to remind you, right? But it doesn't have any effect on the system apart from trying to remind you to get it done.
Okay.
So, but what this does is this. Every 3 months, if you come to appointments or patient monitoring and you come to routine tests, the system now puts all of the tests that has never been done or are past due dates in red, and everything that is still in the future in green. So when you see a unique ID, a client under routine test, and you have next CD4 in red or next viral load in red, it means that either the date is past, is long overdue, or they've never had any of those screenings done before. So if you do it every 4 months in your country, when you see the red flag after 3 months, you should know that you're getting ready for the test very soon. If you do it every 3 months, you see the red flag, you just know that it is already due. So it doesn't matter the timing you use in your country. You just need to understand the flags. And if the flags are raised on the system, it's just to remind you that you need to do the test. And if you clinically you don't need to do the test, then you can just leave it there.
Okay.
Yeah. So is it clear so far, or should I rewind before I go forward?
Can probably go over one more time.
Okay. So once you schedule an appointment, right? The next thing to do is to create a visit when the client shows up. So the flow is this. When the client has an appointment on the system, every client must have an appointment on the system for the system to release the care card. But the system releases the care card regardless of the date of the appointment. Creating a visit must be done on the day the client comes in. And what we mean by create visit is to take the vital signs and statistics of the client. So this will only release the vital sign form if the client has an appointment on the system, regardless of the date of the appointment. I want to take vital sign for clients. So it gives me this form where I will record the temperature, the blood pressure, the pulse, the respiratory rate, the weight, the BMI, and this expires at midnight today. So the thing with the vital signs on the system is that it uses the most recent vital sign of the current dates. Once it is 15th of February, today is 14th, you have to record new vital signs before the care card will be released for clinical management. You can record several vital signs within the same day, and the system always uses the most recent. But you must have one for the current date. I am going to switch systems now After this workshop, I'm going to clean up the data on this system because we've been practicing a lot and putting wrong data. So from here going forward, the wrong data will affect presentations. So I'm going to do that after the workshop, and I'm going to switch to a different system where there's no wrong data and continue this demonstration.
Mildred?
Yeah?
Just a quick question. With the vitals that you just spoke of there that you can take, it doesn't matter how much during a given time the system will boot up at midnight, so the last will be active. But can you see the other vitals, say if you were monitoring someone with a temperature or high blood pressure or so, will you be able to see?
Yes, you'll be able to retrieve
all,
yeah, you can retrieve all past recordings.
Okay.
Okay.
Thanks.
Okay, so I switch the system I'm going to use for this demonstration, and I'm going to update the one we usually use after this training. Now I'm going to use these clients, but I'm going to switch the clients between adult and pediatric. So for our first demonstration, I will make this client an adult. For the next, I'll make the client pediatric so that it will be easy for us to view all the types of forms that we have without having to create new accounts or change clients. Once the client comes on the day of appointment, you come to create visit. You enter the unique ID of the client, and then you click on start visit to record the vital signs. So we are going to assume that he is 36.4. The blood pressure, we'll say 105/80. His pulse is, let's say, 77, and respiratory rate is 15. The weight is 168 pounds. The height is 170 cm. And the BMI is calculated automatically. So we are going to save this because we are working with an adult client. Once this visit is created, now the clinical care coordinator or the doctor will now come to clinical management. Click on waiting clients, and you will see that unique ID on the list of clients ready to be seen. So until you have clients on this list of pending clients, it means that the clients are not yet ready. Maybe they are with the counselor or they've not had their vital signs taken by the nurse. So until this list is populated, you do not have any clients to see. Now we have 3 people on the list. Previously, before the training, I was entering something else, but this is the client we just entered. So this client's card is ready and everything is ready for us to see the clients. So the doctor will now come to clinical management and click on HIV care card. Now take note of this. There is HIV care card, there is TB care card, and there is other care card. We will deal with HIV care card and TB care card today. HIV care card, if the purpose of visit is HIV clinical care. We have a purpose of visit that is TB clinical care. And for those kind of visits, you go to TB care card. If you go to HIV care card, when the purpose is TB clinical care, you will not find the forms released. I'm going to demonstrate that. So because the purpose of visit is HIV clinical care, I will go to HIV care card, put in the unique ID, and it gives me the care card for the clients. Now on this system, HIV takes priority. A client who is HIV positive will have every possible forms generated. A client who has no HIV but TB will have all TB treatment forms. A client who does not have HIV or TB but just other STIs will have other STIs form generated. Everything from TB and other STIs will be added to HIV. So once a client is registered for HIV care, you do not need to register the client for TB care or any other care. It is automatically going to add those forms for the client. Now, when the client was referred from the health center, the system transfers all of the files at the health center so that the clinical care team will have a copy of all the files that the health center has. And as the health center updates for clients who still go back to health centers for other reasons, you will see it updated on this form. So it keeps every possible record found for the clients on the system together in one place. So you have the personal information that was collected by the health center, the risk factors, the comorbid information, the HIV screenings. You can see the HIV screening that was done, the dates and the results before the person was referred. TB screening was never done for this client. Syphilis screening was done and was non-reactive. And then you have other screenings to see if any other screening was done outside of the STI clinic. If contacts are listed, you'll find it here. And extra notes, if notes are left from the health center, you'll find it here. Now, all of this first line of tabs are previous information that the client has on the system. You can update this information, and if those information are updated from the health centers, you will see the update here. So you can use that for quick review if you really want to look into detail at the client's records from every health center that records information for the client. Now we have other tabs. Registration information, and I'm going to label this to reduce confusion, is going to be for HIV positive clients that is diagnosed with TB. So you're going to register them for TB care. Symptomatic checklist is for TB symptom checklist. If you fill this checklist, you will find everything you fill in from previous sessions here. This form is an encounter form. And all the encounter forms are the forms you fill at every clinic day. And once you fill the form, it saves and goes blank for you to fill in new value on the next clinic day. And you only find the values you filled in using the previous record buttons. We have diagnosis and criteria and category, and this is for tuberculosis also. Drug resistance testing, you might use this for both tuberculosis and HIV. Treatment for both HIV and TB or any treatment you give this client. Treatment monitoring to monitor or to do the labs and evaluation based on the side effects of the treatment. We have adverse effects and effects management. You register any drug adverse effects that the client has and how you manage the side effects. And then symptom review, clinical staging, mental health assessment, CD4s and viral loads. So now let's start to see what these forms mean. For a client who is HIV positive, on every clinic day, you want to do the symptom checklist. So you have all these forms here, but you don't use all the forms on every clinic day. You use the forms as they are needed, but there are forms that you use on every clinic day. Symptom review is one of those forms. If there's a need for clinical staging, you will use that form. Mental health assessment for those on ARTS, you will use that form. CD4 and viral load, if you have new values to record. So basically, you'll be using symptom review, clinical staging, mental health assessment form almost all clinic days. Treatment and treatment monitoring when you are giving new prescriptions, and then you will use symptomatic checklist when you are doing your regular TB check. If the client becomes positive for TB, Then you will register for TB. You can do your diagnosis and criteria, the drug resistance testing, and every other form remains the same. I'm going to change the labeling of this so that it can be direct. So this client is here today, and we want to do a symptom review. So all we do with symptom review is to record the dates. And then if the client has any complaint, we're going to put it in. If there's any comments, detailed finding, you type it in. And then you want to look for new opportunistic infections or other problems. You check the list of anything present. If the client is on family planning, you will select the type of family planning. If the client is no longer in care and you want to fill in the reason why the client is no longer in care, transferred out, died, lost to follow up, dropped out or abandoned the program, or unknown. So this is not applicable for these clients. But in the future, when these clients no longer come to appointments over several months and you cannot contact the client, you might want to come to the care card to tick the client has lost to follow up or whatever reason you want to use. So this client's assessment, so let's reassess this client. This client said he has persistent cough and fever. Comments, so detailed findings, you type in. For the purpose of time, I will just copy the same thing I put in here, but you type it in properly. The client has cough and shortness of breath, fever, and unintended weight loss. The client uses condoms. The client is symptomatic and might have opportunistic infection. We want to do some lab evaluation, screen for tuberculosis, symptomatic treatment and pain control. And then we want to put the ARV therapy. We want to start new treatments. And then what treatment are we going to put the client on? Let's assume we are going to use this. If there's any other medication that is not on the list of the ARTS list and the TB drugs, you type it in here and you click on save. Once you have done this, this is the major form you will use on every clinic day. The form clears out for you to enter record new values. So it's an encounter form that you record every time. And I'll show you how to retrieve the care card of past information. The next thing you want to do is to go to clinical staging. This client has severe weight loss. This client has fever. The client has, let's assume that the client did the HB and the HB was very low. So the client is in stage 3 based on all the symptoms. And so I'll have to put in the dates. This is also an encounter form. And so it clears out once you fill it in. The mental health assessment form. This form should be used for clients on ARTS to see the effects of the drug on the mental health. And also you can also use the form for other reasons, but you can also access or assess all of the clients on every clinic day for mental health. And what this does is it looks at 15 different domains and gives a threshold that will guide you to further inquiry or referral to a psychiatrist. So it checks for depression, for anger, for mania, for anxiety, for trauma, for suicidal ideation, for psychosis, for sleep problems, for memory problems, for repetitive behaviors and thoughts, stigma, personality functioning, for substance use, sexual behavior, and dissociation. How this form works is it explains all of the domain, and then it asks questions that guides you to place the clients on a scale from none to greater. In the event where a client has a particular symptom and the score for that symptom is above mild, then you want to refer for further evaluation or inquire further. And I'll show you how, because explaining is more confusing. So we'll put in the dates today. So was the client incarcerated in the past 90 days? Let's say no. Current medications that this client is on. So the client is not on any HIV medication yet, but we are going to prescribe today. Risk behaviors in the past 90 days. Has had unprotected sex, illicit drug use? No. Any sex without disclosing HIV status? No. Now, you want to categorize these clients based on symptom, if any. But for now, we don't know any, so we're going to leave this and go straight to the assessment. Now, this is the assessment. The first domain, which checks for depression, is asking 2 questions. So you're asking the client, in the past 2 weeks, have you had 1, little pleasure in doing things? On a scale of 0 to 4 or 1 to 5, if the client says not at all, so that is 0. If the client says sometimes or maybe rarely, less than 2 days in the 2 weeks. If the client says several days in the 2 weeks, that is mild. Or more than half of the days in the 2 weeks, that is moderate. But nearly every day, that is severe. Let's say the client says, for the past 2 weeks, he has not had interest in doing anything. 4. The second question under this first domain is, have you felt down, depressed, or hopeless in the past 2 weeks? He said, yes, every day he feels hopeless. Now, the domain score for this domain 1 is 4, 4 for both questions. And you record the highest domain score here as 4. Now, number 2, felt more irritated, grouchy, or angry than usual. Let's say he said several days, like 4 or 5 days in the week, and the domain score here is 2. Number 3 has 2 questions also, and the numbers are just the domain numbers. The domain number 3 tests for mania. So for this, you're asking, have you slept less than usual, but still have a lot of energy in the past 2 weeks? The client will say, maybe less, rare, less than 2 days in the 2 weeks. Have you started lots more projects than usual or doing riskier things than usual? And then maybe he says, more than half of the days in the 2 weeks. The highest domain score for domain 3 is 3, so I'm recording the highest. So you get the idea. If there are several questions under a domain, you are going to record the highest domain score for that domain. The form gives you a guide for referral or further inquiry. The first domain tests for depression. And if the person has a score that puts the person in a mild category or higher than mild, then the person should be referred or you should inquire further. So once the domain score for 1 is above 2, then this person is a candidate for referral or for further evaluation. Is it clear or am I going too fast?
It's clear, Mildred. But what I was thinking, you see how you have the list of domains?
Yeah.
On top?
Yeah.
Could you have like domain 1, put depression there just for memory's sake to avoid the up go up to see what is domain 1, because like you can say to the client, let's talk about depression.
Okay.
Because you will see domain 1, depression in the space there.
Okay. Okay, I'll do that after this workshop.
Okay, thank you.
Okay. So you do that for every question and you will record the highest domain score. And then you can now use the guide to know when to refer. And if you have services you offer within your sites without referral to a different specialist, then you want to inquire further about the depression because the threshold is more than mild. For anger, it is slight. So even if it's 1 for anger, you want to inquire further. 3 tests for mania. And even if it's mild from 1 here, if the highest domain score is greater than 0, you want to inquire further. So let's look at domain 4. Felt nervous, anxious, frightened, worried, or on edge. So if it says no, never happened in the last 2 weeks, felt panic or was unusually frightened. Let's say yes, he had that all through the week. Avoided situations that made you anxious. Yes, the highest domain score here is 4. You want to inquire further about this to check for anxiety disorder, right? Domain 5, have you directly experienced or witnessed a traumatic event in the last 2 weeks? He says no. Has he attempted to avoid distressing memories? He says no. And then the highest domain score here is 0. Domain 6, had serious thoughts of hurting yourself. We're testing for suicidal ideation here. And he said just 1 day in the past 2 weeks. And the highest domain score is 1. Heard things other people couldn't hear, such as voices, even when no one was around. He said he didn't have that in the past 2 weeks and felt that someone could hear your thoughts or that you could hear what other person was thinking. He said there was a particular day in the week, there like 3 days in the week where he felt like people were laughing at him and he felt that everybody was hearing what was in his mind. And so today, the highest domain score is 2. Had problems with sleep that affected your sleep quality overall? He says no. The highest domain score is 0. Had problems with memory, that is learning new information, or with location, finding your way home? And he says no. Had unpleasant thoughts, urges, or images that repeatedly enter your mind? He says just few days in the 2 weeks. And felt driven to perform certain behaviors or mental acts over and over? He said yes several times. So the highest domain score is now 2. Felt that people treated you differently because of your HIV status? Let's say he says he feels like that all the time. And felt out of place in the society? He feels that all the time, so it's 4. So let's look at domain 12. Not known who you were. He said he has not experienced that in the past 2 weeks. Not felt close to other people or enjoyed relationship with them. He said he always feels that way. Drank at least 4 drinks of any kind of alcohol in a single day. He said all the time. And used any medication on your own, that is without a doctor's prescription, on greater amounts or longer than prescribed, or illicit drug? He says no. Try to reduce or stop drug or alcohol use? He says yes, most of the time. He's no longer taking alcohol. Engage in sexual activity to numb painful feelings and or memories or to reduce anxiety. He said just like 2 days in the 2 weeks. Felt guilt or shame either before or after engaging in sexual activity? He said never. And feeling detached or distant from yourself, your body, your physical surroundings, or from your memories? And then he says most times in the week. So let's record highest domain score here is 4. The highest domain score here is 0. And the highest domain score here is 2. So with all of this that we filled in, if you come back here, you will see different presumptive or different diagnoses that you want to assume the first time. Are you diagnosing this person for trauma, anxiety disorder, obsessive compulsive and related disorder, depressive disorder, bipolar or related disorder? If you are not sure, you leave this blank. If you are sure something is actually wrong, then you want to put what you think is wrong before referral, because most of the domain score here actually indicates that this client should be referred or further evaluation is needed for this client. So we'll say we are assuming some anxiety disorder, and then we are going to save this. So we've saved the mental health assessment. No, you are not diagnosing, you are putting what you think, what you're suspecting. Because now you see, after asking the questions are not as comprehensive, but there are questions not on this form that you might evaluate further. And based on your evaluation, you put what you think and then refer. So what you think is not really what it is, but it is what you think at the time or based on your discussion. So once you do this, it's an encounter form. The next time the client comes, you fill in the forms again, the same questions. So as you go through these forms, it will now be easier to know exactly what questions to ask based on the symptom and asking without reading it out to the clients, and to save you time once you get used to what you're trying to look for in a client. Then if you have new CD4 and viral load values, at this visit, you can fill this in here. So let's say the lab is on the table, it returned, and the CD4 cell count for this client is 220, and the viral load is, let's say, 30,000, and we save. So I'm going to take it from the beginning before I go further. Once a client comes in the clinic, if the client is already registered in care and the client has an appointment for the day, you come to the pages menu and go to appointments/patient monitoring. And then you select create visit. If the client does not have an appointment and the client is going to see the doctor today, you schedule new clinical management appointments and select the type of clinical management, if it's HIV clinical management, TB, or other clinical management. This type is very critical to the care card that the system, or to the part of the system where the doctor is going to get the care card from. Once you schedule the appointment on that day, you can go straight to create visit. So the flow is schedule appointment, create visit, and then they move to the doctor. Creating visit just means taking the vital signs and other statistics. Once the appointment is done, the visit is created, then you come to the clinical management menu here. You expand that, and you have a list of 5 menus. One is waiting clients, which gives the doctor the list of clients who are ready and are waiting for the doctor. So this list is only populated after the vital sign has been taken. After vital signs have been taken, it means it is time to see the doctor, and then you can follow the list to call in the clients in this order. But the system puts last one in, first one up. So if you want to go in the order in which they're waiting, you have to start from the bottom to the top. This list is going to be cleared by midnight. Vital signs expire at midnight. You can take several vital signs in a day, but the last recorded vital sign must be on the same day you are accessing the care card. If it's expired, the next thing you have to do is to create a new visit, take another vital sign before the care card is released, because the vital sign must be populated on the care card before it is released. Once the purpose of visit is HIV clinical care, you will come to clinical management, come to HIV care card. You will want the HIV care card for HIV clinical care. You put in the ID. Sorry, I put in the wrong ID. On the care card, you have the first two flags is to tell you whether CD4 test has been done and when the next test is due. This is just a reminder. Once it is in green, it means that they've had a test done recently. In blue means that it is due for a test on that day. In red means that you might need to consider doing another test based on your evaluation. It gives you the trend of all the recorded CD4s and viral loads for the clients on the system. So you will see the trends on different dates, starting from August to now, to see if the CD4 is going down or going up. But in this case, we see the CD4 is coming down and the viral load remains the same. The BMI trend also helps us to see the weight loss or weight gain patterns. Adherence assessment reports. We are going to do this workshop for counselors next week, and then you'll see the report if the counselor feels in that they feel the client is adherent based on their adherence, medication adherence follow-up session. So on this report, if you see not adherent, then you want to decide if you want to continue prescribing or stop. If the lab records a drug resistance test for HIV drug resistance, you will find it here. But if not, you will only find flags for other screenings like TB and syphilis. If they are done, it will tell you that they have those tests recorded on their card, and you can go to the tab to see those screenings. The next thing is a container holding tabs of all the records that this client has on the system from different health centers in one place. You do not have need for all of this on your clinic day, but it is here for you to see the personal information that the health center would have collected when they screen the clients, the risk factors information. If you still do risk behaviors every visit, you can still fill in this to have the client risk behavior if you want to still put a client who is in care on risk reduction plans. The comorbid information that was filled in at the health center, if it wasn't filled in, you can fill it in at this visit. The HIV screening that was done, the TB screening results, and none has been done for this client. The syphilis screening and the results, other screenings that were done for the client, the contact listing, if the client has contacts that are listed to be traced, and if the client has not listed contact, I want to list it at the infectious disease clinic, you can put it in there. If you want to leave notes here for anybody, maybe the health centers, or on the next clinic day, if you're not going to be available to see what is done or any important notes, you can leave it there. You can upload screening results if you have any paper form you want to upload, like a scanned image, or you want to type in a report from a screening. These 10 tabs we just looked at are not needed on a clinic day, but they are there for record purpose and for you to refer to if you need any information. Let's assume that this client came in and we are doing the symptomatic checklist for TB. So cough for more than 3 weeks, the client says yes. Persistent fever, yes. Coughing up blood, he says no. Excessive night sweat, he says no. Harshness, he says yes. Chest pain, he says yes. Fatigue, he says yes. Loss of appetite, he says yes. Unexplained weight loss, yeah, we can see. Let's say he has lost weight. Let's assume he lost a lot of weight. Has the client been previously diagnosed or treated for TB? No. Has the client been in contact with a person known to have TB or long-standing cough? No. Now, based on your own clinical evaluation, do you suspect the client to be a TB suspect or not? So we'll say suspect. Are you going to refer for AFB or chest x-ray or TB treatment, or the client is going to be on CPT or CPT? You're going to fill this in. So we're going to refer for AFB for chest x-ray, for TB treatment, and the client is going to be on both TPT and CPT, and save. Once you do this, let's make another assumption that the result returned and this client is diagnosed to have TB. So I want to fill in a TB screening here. So we're going to do the gene expert, and it was MTB detected, RIF resistance. So this client has TB now, diagnosed to have TB. I will come to the registration information and register the client for TB. So this is going to count as a HIV-TB co-infection, but you need to do the TB registration so that the clients can go to a TB clinic in the event where you have a separate HIV and a separate TB clinic, and the people handling TB and HIV are totally different. So they can go to TB care card and just get TB related information. So this client is going to be officially registered for TB treatment. You can give TB treatment without the registration, but the registration helps your reporting to be able to accurately calculate the number of people who were registered for TB. And apart from that, it gives the information of, have you ever been vaccinated with BCG? He said yes. Have you been treated previously for TB? No. Have you had an abnormal X-ray suggestive of TB? He says no. So do you take greater than 15 milligram per day prednisone for greater than 1 month, or currently taking prescription arthritis medications? He says yes. Are you a resident of or current employee of a high-risk setting? So if the client works in a correctional facility, a nursing home, or homeless shelter, or any healthcare facility, you click yes. If not, no, and save. So now we have these clients for HIV and TB. How was this client diagnosed for the TB? You want to fill it in. The diagnosis for TB was based on, so the pulmonary TB, let's say that, and the criteria was confirmed, and the diagnosis criteria category is new. Why this form is important the first time. Now take note that registering for TB and the diagnosis and category is a one-time thing. You are filling this if this is a new TB, so the system can accurately calculate new cases or a relapse, or maybe treatment after first line, or treatment after failure of first-line drugs, or previously treated but the outcome was not known, or treatment after loss to follow-up, or treatment after failure of retreatment regimen with first-line drugs. So you want to select what this is. So this is new, and we'll save. So you are done with registering this client for TB. These ones that are one-time forms are not encounter forms, so they retain the values so that next time you come, you can update them. Drug resistance testing. He did gene expert, right, with the rifampicin resistance.
Yes.
So so we're going to do this as the specimen was, what specimen do they normally use? Blood, sputum? Anybody? What specimen do you use for the drug?
So gene expert, they do blood.
They do blood, right? and then is resistance. So you want to save this here. So you can also fill in HIV resistance, but there is a part where the lab or the testing site updates HIV drug resistance. So you have the history on the right side of the page. So you can always see all of the drug resistance testing and the results for the test. When you go to treatment now, I'll show you something about this. Because I have records for this client on the system, when it comes to treatment, you fill in the medication, and this is populated based on what you enter as a treatment you use in country during system configuration. You choose the drug, both for HIV or TB. You choose the phase or the regimen. You choose the dose of and frequency. You choose the duration, and then you put in a note if you want to do a follow-up for that treatment. This treatment form gives you the most recent test results for HIV, syphilis, and tuberculosis to guide your prescription. And it gives you the dates they were diagnosed. So if you want to go further to other files to see if these were treated, you can go further, but you will see it here in your treatment history, what has been prescribed in the past. But it has been prescribed in the past does not mean that the client has taken it. So above this form, you will see a report from the pharmacy, and we are going to look at this in the third part of this session, how the pharmacy dispenses and it populates on the client's page to see that the client picked up this medication on a particular date. If you don't see this history here, it's either the pharmacy is not using the system or the client never picked up the drug. So you have your answer here. You prescribe this, but the client has not picked it up because it is not there on the list of pickup from the pharmacy. So when you give your prescription to the pharmacy, you want to make sure the unique ID of the client is there. So when they dispense, they use the unique ID for the client. And then the system will automatically add that to the client's page that the client picked up the medication and on the dates the client picks it up. So the next thing you want to do for the adherence now is what the counselor will give as a report of assessing the client if those medications were taken or if there were any difficulties in taking them or if the client has missed any dose. And you get that report as a flag on the page if the counselor feels that the client is not adherent. But on this treatment page, you see the prescription that was collected, that was dispensed here. You will see the history of the medications you've given out so you can compare. You have written this in the prescription, but it is not here. So the client never picked it up from a pharmacy or got it from a pharmacy that did not record it on the system. So, but now you have to find out if the client ever got that meds or took it because you don't see it on the history of drug pickup. So you can keep adding treatments for every clinic day, and all the treatment history will remain here, and all the drug pickup history will be populated above if the client picks up medication from the pharmacy. Treatment monitoring. When a client is on drugs, things can go wrong, right? There are different things to monitor. You can use the other screenings to screen for an exhaustive list of stuff. So this list is populated based on the list of screenings that are done within country and is populated by your administrator when your system is configured. Or you can come here to do a pre-configured list of you want to monitor the treatment. So we're trying to do, if this was just a TB client, you might want to monitor, do HIV screenings periodically. Or based on the medications, I want to do a liver panel. There's also a renal panel that you can do. I will add it to this list, or you can use the other screenings. So let's say you want to do this. So the form on the right of this will give you the history of the type of monitoring you are doing for the clients that is being treated. Then we have adverse effects and adverse effects management. So in the past, this client has listed all of this as the adverse drug effects, and this was how they were managed. So we have a list here that you can select from what the clients, one of the possible things that can happen as a side effect of the medication. And we have a list of things that you can select that you did for the management. So for extreme cases where you change the dosing and frequency, or you change the drug, or you stop the medication if it's for a TB drug. So under each of them is a save button, and when you save them, the history appears here for what was done for the treatment adverse effects monitoring. Once you are done with this, you are done for the day. So you can see that the forms are optional. On every clinic day, you're not burdened with filling all of them. So you just go over the forms that exist and know what it is that you normally use all the time. What I know will be used most of the time is the symptomatic checklist, the symptom review, the clinical staging, mental health assessment form. The others are conditional. If you are giving prescription every 3 months they come, then you use the treatment. If you have clients who just come for checkup every 3 months, but you give them a 6 or 9 month supply of drugs at once, then you might not need to use treatment, or you can review treatments to see if they picked up their medication and the dates they picked up the medication. So that if you need to send the client to an adherence counselor, maybe the client had exhausted the last prescription and the client took 2 extra weeks to pick up the medication. So you know that what happened between the last 2 weeks that the client had no medication. On the day a client visits, before you go to the care card, you have the option to review the previous encounter. So this previous encounter does not require vital signs to be taken or anything. It's just there for the doctor to quickly review the clients they have for the day. So symptom review, you have the date and the time this was recorded, and for every symptom review that has been recorded, so this has 2 different symptoms recorded on different days. You will see what the symptoms were, what the plan was, what the medication was. So it gives you the past history of recordings of that client. So you can review this even after the client leaves, before the client comes. You can review the CD4s and viral loads that were recorded on different dates. The clinical staging that was done differently on different dates, it gives you in each container. So the green banner above gives you the date and time that was recorded. So the most recent recording is usually at the top. The mental health assessment recording will be there. The most recent will be on the top, but you have different containers of different recordings to see how the client is doing. So you have everything recorded here. And I was going to make this printable. I can make it printable if it's something you want to print out to give the clients when you refer the clients somewhere. So this is how you look at past encounter. I will add the vital signs here for you to see, to look at the history of vital signs. Karen, I know you asked that question. I just realized I didn't put it up there.
Thank you.
Yeah. So for every client whose past record you want to look at, you come to clinical management and you go to previous encounter. Enter the unique ID, and then the system will give you the encounter forms, the last recordings that you have. Any question before I go further? Is it clear?
It is clear, Mildred. It's just that, you know, at this moment, there are so many information for you to digest. So inside of your head, you're just trying to figure out if you get it right, if you're following it. So I guess maybe tomorrow when people go over today and they will see where and what if they have any question. But for now, you're just trying to take it all in.
Okay. Yeah, so the first time by Wednesday, we have hands-on with proper case scenarios and it will be easier to understand. But tomorrow we will have a repeat of this session. And there are more than half of the people opted to join for tomorrow. And if you're here today and you feel you want to join tomorrow, you can do that. I will make the normal practice system ready for you to be able to try hands-on by the end of the day. Yeah, and I will give a workflow also. I'll upload it on the page later so that you can follow. So we just looked at clinical management for an adult client. We are going to take a 10-minute break and come back and look at clinical management for a pediatric client.